The dynamic visual acuity test is a portion of the bedside oculomotor exam that assesses a patient's visual acuity with their head static or not moving versus their visual acuity with their head moving or dynamic. The patient is asked to read the lowest line possible on an eye chart.
O, K, S, V, Z.
After that line is read, the examiner will stand in front of the eye chart to prevent the patient from memorizing subsequent lines. The patient will be instructed to close their eyes. Once the examiner moves behind the patient, the examiner will move the head approximately 2 hertz or 2 cycles per second. The patient then will be asked to open their eyes and again read the lowest line possible. The examiner flexes the head forward, begins to rotate, open your eyes, and begin to read.
N, O, Z, C, D.
Once the line is read, the examiner stops shaking the head and notices that there has been a 2-line change. The dynamic visual acuity test is considered positive if there's greater than a 3-line change. So for this patient, the dynamic visual acuity test is negative. Patients with vestibular deficits often have difficulty with dynamic visual acuity. This concludes the dynamic visual acuity test.